Hello, my name is Ubhord Evong. I'm a third-year medical student doing my rotation in psych with Dr. Martinez. Today I'll be talking to you about post-traumatic stress disorder, also known as PTSD. PTSD can occur at any age, including childhood, to anyone who has experienced or witnessed a major traumatic event. Symptoms usually begin within the first 3 months after trauma, although there may be a delay for months or even years before symptoms appear. Most of the traumatic events that can cause PTSD directly include, but are not limited to, military combat, violent personal assault, such as sexual assault, physical attack, robbery, mugging, being kidnapped, being taken hostage, terrorist attack, torture, incarceration as a prisoner of war, natural or man-made disasters, severe automobile accidents, or being diagnosed with a life-threatening illness. Witnessed events including observing the serious injury or natural deaths of another person due to violent assault, accidents, war, or unexpected witnessing a dead body or body parts. According to the DSM-4 diagnosis and criteria, there are about 6 criteria for diagnosis of PTSD. The first criteria is the development of characteristic symptoms following exposure to an extreme traumatic stressor involving direct personal experience of an event that involves actual or threatened death or serious injury to one's physical integrity, or witnessing an event that involves death, injury, or a threat to the physical integrity of another person. In second criteria, in adults, the response to the event must involve intense fear, helplessness, or horror, while in children, the response must involve disorganized or agitated behavior. Criterion B. The characteristic symptoms resulting from the exposure to extreme trauma include persistent reliving of the traumatic event, which disturbs day-to-day activity. The person constantly has flashback episodes where the event seems to be happening over and over again, recurrent distressing memories of the event, their repeated dreams of the event, physical reactions to situations that remind them of traumatic event. The criterion C. There's persistent avoidance of stimuli associated with the trauma and numbing of general responsiveness. Emotional numbing or feeling as though they don't care about anything. There's feelings of detachment. There's lack of interest in normal activities. There's less expression of moods, usually staying away from places, people, or objects that remind them of the event. Criterion D. There's persistent symptoms of increased arousal. Here there's difficulty concentrating. There's an exaggerated response to things that startles them. There's excess awareness, usually called hypervigilance, irritability or outbursts of anger at inappropriate times, sleeping difficulties. Criterion E. The full symptom picture must be present for more than 1 month. If less than 1 month, is described as an acute stress disorder. In criterion F, the disturbance must cause clinical significant distress or impairment in social, occupational, or other important areas of functioning. There are 3 specifiers used to describe the onset and duration of symptoms of PTSD. We have the acute specifier, which is used when the duration of symptoms is less than 3 months. The chronic specifier is used to describe when the symptoms last 3 months or longer. Delayed onset, this specifier indicates that at least 6 months has passed between the traumatic event and the onset of symptoms. The main forms of treatment include psychotherapy, behavioral therapy, and pharmacotherapy. Psychotherapy, this aims to reduce symptoms by encouraging patients in a doctor-patient single session or in a support group setting to recall the events, express their feelings, and gain some sense of control over the experience. For behavioral therapy, called graded exposure and flooding, this is used to treat avoidance symptoms. This usually includes exposing patients to objects that trigger symptoms until they become used to it and no longer want to avoid it. Underlying symptoms of depression, alcohol or substance abuse, and other related medical conditions have to be treated while addressing the symptoms of PTSD. Therefore, pharmacotherapy is employed. Pharmacotherapy is the use of medications that act on the nervous system, such as beta blockers, benzodiazepines, antidepressants like SSRIs, can help reduce anxiety and other symptoms of PTSD. For the prognosis, The severity, duration, and proximity of an individual's exposure to the traumatic event are the most important factors affecting the likelihood of developing this disorder. Duration of the symptoms varies, with complete recovery occurring within 3 months in approximately half of the cases. But many other cases have persisting symptoms that may last longer than 12 months after the trauma. Thank you for your time. See you soon for yet another talk. Bye.